did you know the FDA actually got rid of the black box warning 2 weeks ago? So I thought this would be a good opportunity to do a YouTube live. So I'm Dr. Jen, double boarded OB/GYN and integrative medicine. My channel is all about perimenopause and menopause, and I help women sort of gain clarity and confidence in this time in their life and pivot to be healthy long term. So the FDA had a black box warning that was put on all estrogen products about, we'll see, 2003. So 20, what are we, 26 soon? So 22, 23 years ago. Basically, the Women's Health Initiative trial was a study that was done, and the study results released in early 2000. And this trial looked at what is the breast cancer risk, blood clot, stroke, what are the cardiovascular disease risks related to putting women on hormone replacement therapy. And at the time, we used synthetic estrogen and synthetic progesterone called progestin. So that trial was stopped prematurely because at the time, the risk of breast cancer was known to go up, and the risk really was stopped because of cardiovascular risk. They were noticing there was more heart disease, stroke issues, and they decided to stop the trial prematurely, and then to report that hormone replacement therapy could be linked to higher rates of cardiovascular disease. So because of that, the FDA put a black box warning on estrogen products. And these were all estrogen products. So birth control pills, hormone replacement, everything. So that black box warning that the FDA put on has been on since 2003. And when it was placed, it essentially said that if you take estrogen in any form, you might have a higher risk of heart disease or breast cancer. Most people kind of took off with the breast cancer risk. So when the black box warning was removed last week or 2 weeks ago, something like that, it's a victory because unfortunately the warning that was put on there kind of scared doctors to prescribe hormone replacement, and women didn't want to take hormone replacement. So I thought I would just talk about the 5 facts about hormone replacement therapy because I think this is often confused and women aren't getting appropriate information. So here are kind of the 5 frequent questions that I get asked in my medical practice. The first one is always, is estrogen safe? Can I get breast cancer if I'm on hormone replacement therapy? And the data, actually, if you look at the Women's Health Initiative trial, which was 23 years ago, it said that the increased risk of breast cancer was actually due to progesterone, not estrogen. So the arm that had progesterone and estrogen had increased risk of breast cancer, not the estrogen alone arm. But for some reason, over the 23 years, this narrative has stayed to where we think estrogen is the problem. But in that trial, the WHA trial, then it was known that the estrogen, which was synthetic estrogen, and the synthetic progesterone, called progestin group, was the group that actually had the breast cancer. And it was 1 person per 10,000 people. So 1 extra person was diagnosed in that group. And at the time, when they studied those women for 20 years, their prognosis didn't change at all, which means the women who were diagnosed with breast cancer who were on hormone replacement therapy back then, they did not have a worse outcome. So they didn't get diagnosed with a higher stage. And so now, after watching that trial or watching the study for 23 years, we've realized that there are 2 important things related to estrogen and breast cancer. 1, synthetic is a problem over a bioidentical. And the word bioidentical basically means if you have estradiol in your body when you're 25 years old, then you replace it with estradiol. You don't give them synthetic, which at the time Premarin was synthetic. You don't give them synthetic, you give them bioidentical, which is estradiol. Number 2, you need to make sure you also give bioidentical progesterone, because the progesterone that was used at the time was progestin, which is a synthetic as well. So now most of us that provide menopause care, that do hormone replacement therapy, we always use bioidentical or body identical, same idea, which means that you get estradiol and you get progesterone. You don't get ethinyl estradiol and progestin. You get the actual real versions. So the risk of breast cancer is extremely low. And certainly when we talk about hormone replacement therapy, it does not increase your risk for breast cancer if you're using bioidentical hormone replacement therapy. So the second question I get asked a lot is, how long can I be on it? And that guideline actually changed in 2019 when there was a consensus done of like worldwide, literally, you got experts everywhere in the world that sat down and said there's no reason that someone who starts hormone replacement therapy has to stop it after 10 years. We used to say that. We used to say you get 10 years, that's it, voila, it's over. But now the guidelines essentially say you can take it until your last breath, essentially. As long as your health hasn't changed, you're not like smoking or, you don't have other risk factors, you can actually keep it long term. So the third question I get asked a lot about facts, and if you guys have questions, I think I can answer though. I don't see anything popping up in the chat, but if something comes up, I'm happy to answer them. So the third question I get asked a lot is, can you start it like in your 60s? What if you whisk the window from 50 to 60? Can you start it? And the answer is yes. We don't have to go with that window of opportunity anymore. That again was based on that Women's Health Initiative study. And so we don't have to just say you're 65 and you can't start that. You need to talk to your doctor about your risk factors, but you can still start hormone replacement therapy even if you're 60, 65. It depends on how healthy you are. Let's see. Number 4 question. Oh, once you start hormone replacement therapy, how quickly does it kick in? How do you know how long it's going to take for you to feel better? And the truth of that is actually some things work a little faster than others. So for example, progesterone helps you sleep, helps you get to sleep and stay asleep. So progesterone actually works fairly fast to get to work. So within a couple of days, usually women are sleeping much, much, much better. And within 30 days, they feel that the symptoms of low progesterone are so much better. And those symptoms can be can't get to sleep, can't stay asleep, agitated, annoyed. You find you are getting irritated at your husband for breathing. Those are all progesterone type symptoms. So women notice pretty quickly when progesterone kicks in. Estrogen takes a little bit longer. So when you start on an estrogen, either patch or pill or ring or whatever you're going to use, it typically takes a couple of weeks and sometimes up to 90 days, especially for symptoms like brain fog to get better. It just takes a while to kick in. But most women within about 60 days feel like themselves. I notoriously hear that women are like, I feel like myself again. Testosterone also takes a little bit longer. Testosterone, most women take about 60 to 90 days to feel a difference on testosterone. And interestingly enough, testosterone seems to get better and better with time. So the longer that you're on it, you start noticing the symptoms like low libido get better, building muscle, brain focus, energy. Those things just seem to get better and better the longer that you're on it. So usually you need 60 or 90 days on testosterone. Okay, let's see. What are the other questions I get asked? Oh, will hormone replacement therapy make me gain weight? Hormone replacement therapy is not a weight loss strategy, but many, many women, when they get their hormones back into balance and things are working much better, especially with perimenopause and menopause, actually start losing weight. Because when things, estrogen and progesterone really throw insulin off, and then you become insulin resistant and suddenly you're gaining weight and you're gaining weight in the midsection. And so women actually notice frequently. I see patients who come back 6 months later and say, whoa, I lost 10 pounds out of nowhere. Like, well, it's not really out of nowhere. You actually got your hormones in check. So now it kind of made the other hormones be in check as well, which is great. So it's not really a weight loss strategy, but a lot of women do lose weight once they actually get stable on the right regimen. Let's see. So I answered 4 of those. What was my last one I wanted to talk to? Unless you guys have questions specifically about hormone replacement therapy. What happens if I stop hormone replacement therapy? So sometimes patients will ask me, like, if I start it for a couple of years and I just want to stop, is that okay? And the answer is yes. You can stop at any time. Within a couple of weeks, those hormones will be out of your body. So you'll know what sort of menopause symptoms remain. So if you're on HRT and you decide to stop it, it's okay. It doesn't have to be weaned down, or you don't have to do anything special. And likely if you decide, well, I was off of it and I really want to be back on it, then you can restart your hormone replacement therapy. One thing I want to mention that often isn't talked about enough is even if you have, very few women are not candidates for hormone replacement therapy, which means that most women can, they just need access, to be honest. A lot of doctors still won't prescribe it for some reason. It's just, to me, so antiquated, but most women can. Even breast cancer patients can take vaginal estrogen. Yes, that's really, really important because really they need vaginal estrogen so much. So if your physician has told you you're not a candidate for HRT, I would strongly make sure you get a second opinion, because often most women are candidates for it and they just haven't found a provider that's comfortable enough to prescribe hormone replacement therapy or even comfortable in general with menopause care. Remember literally no joke, there was a survey done by Forbes 2 years ago, and it said only 22% of OBGYNs feel comfortable taking care of menopause women. 22%, 12% of primary care doctors. We're the ones that's supposed to have the most meta-knowledge as an OBGYN, and unfortunately we don't. So it's important that right now there's still a lack of providers that really provide menopause care. So if you feel like you need it or want to look at that as an option, make sure you find a provider that's comfortable with menopause care. I would suggest that when you call an office, you ask, how many people in menopause do you guys take care of? Because most OB/GYN practices are actually set up to really deliver babies. So they may not see a lot of women in menopause, and so it may be harder to get someone who's experienced in this category. So definitely look into those as options. And there are plenty of us out there. You just have to do a little bit of digging until this education is becoming more and more. So hopefully you got some information here that's helpful. So these are the 5 facts about HRT that I get asked every single day. If it doesn't look like anybody has any questions from it. So I'm going to try to pop on here. My channel is all about perimenopause and menopause, and I'm going to try to pop on here every Wednesday at 8 and just answer frequently asked questions. So if you guys have questions, you can certainly send them through YouTube, and then I can actually answer them next time when I do a live. Oh, there's one in here. I don't know how to approach my doctor. So the first couple things I would say is, one, when you call the office, make sure that you ask them, how many menopause women do you take care of? Because if they're an OB/GYN office, they frequently take care of women having babies, and they don't have a lot of providers that take care of menopause women. So how many menopause women do you actually take care of? Like, what is your kind of demographics of your practice? That's one thing. 2, the doctor that I'm going to see, what does she usually prescribe? Because there's still a lot of lack of knowledge of all the options. I'm integrative medicine trained, so I use holistic medicine, I use traditional medicine, I use alternative medicine. So a patient may come to me and I may not necessarily prescribe HRT. We might talk about herbal therapy, or we might talk about nutrition or lifestyle. So you need to make sure you're in line with what that provider prescribes. If they only prescribe FDA prescribed or FDA approved medication and they won't do testosterone, you need to know that before you actually go there. So make sure that when you ask the office, what do they typically prescribe, you'll get an idea as to, is that provider pretty knowledgeable in all the options. And then 3rd, bring a list of your symptoms. No joke. I love when someone comes in with a big old list and says, here's the 20 things that I'm dealing with, because often I can connect the dots for that patient and they can see, oh my gosh, my anxiety, my heart palpitations, my hating that my husband's breathing too loud, my itchy feet are all connected. So bring a list of those symptoms, and even if they're connected to like a cycle tracking, if you actually write them down and say, hey, these happen on day 22 of my cycle, this is what usually happens on day 1, that's even more information for your provider to be able to understand how to personalize what they give you as an option. Because it is really, really personal. Over 80 symptoms associated with perimenopause and menopause. So what I am going through may not be what you're going through. So you need to make sure you can bring those to the table and say, these are the things that are my symptoms I'm having. This is what I need help with. And if that person is, like I said, if you've already vetted them to know that they prescribe all different options and they take care of menopause women, then you should be in good hands from that perspective. All right. Thank you for joining me on this live. And I will pop in next Wednesday. I'll try to do this Wednesday at 8 o'clock Pacific Standard Time and try to answer some questions. But if you guys have questions, send them to me through YouTube and I will put them on for next week. Thank you.